Okay, today we are going to start the next topic, that is absorption of drugs. So anybody from you can tell me what is absorption? Yesterday we studied about the intake of drug, that how we intake the drug into our body. So today we have to study about the absorption. We can take the drug in any way: orally, parenterally, and topically. There are main three ones. Today we have to check how we can absorb the drug. The first one step, administration of the drug, and this next one is absorption of the drug. We know all that there is no need of absorption of drug when we are given the drug in the form of IV, in the form of the injection, intravascular, in the veins. Today, the next one is absorption. So absorption of which type of drug? We know this thing that if we are not going to study about the absorption, then it means there is absorption of the oral drugs. So first of all, absorption is movement of unchanged drug from site of administration to systemic circulation. When you are going to take any type of medicine orally, for example, syrup or tablet, it has to absorb into your blood. But how? When you are going to take it, it will move from your mouth toward the stomach and then intestine, from where it is going to absorb into the general circulation. There are main four types or four mechanisms of drug absorption from the GI tract. The first one is passive diffusion, the second one facilitated diffusion, third one active transport, and the fourth one endocytosis and exocytosis. Passive diffusion, what is it? Diffusion means movement of the molecule from the high concentrated area to the low concentrated area. So in the passive diffusion, the same thing happens. The drug is going to move from the area where it is present in high concentration. For example, in the gut, it is present in the high concentration. So it have to move toward the blood where it is present in the low concentration. It does not involve any carrier. It does not need any energy. But still there is something happen in passive diffusion, the water soluble drugs and the lipid soluble drugs. We all know that the lip membrane is made up of lipid bilayer. So it's easy for the drug, for those drugs that are lipid soluble, to move through the membrane by diffusion process. But when we talk about the water soluble drugs, then in the membrane there are some pores or channels through which the drug is going to move. Okay, the next thing is facilitated diffusion. Facilitated diffusion is also a type of diffusion in which the drug is going to move from high concentrated area to the low concentrated area, but it needs carrier proteins. On the membrane, there are proteins are present which act as a carrier and move the drugs from the high concentrated area to the low concentrated area. Inhibited, the last one point, inhibited by compounds that compete for carrier. So there are more than one drug who need the same type of carrier. So they can be inhibited. They can inhibit the excretion or absorption of one drug. The next thing is the active transport. Okay, the next one is active transport. After the facilitated diffusion, there is an active transport. For the active transport, we need carrier and we need energy. Why we need energy in the active transport? Because we are going to move the drug from the low concentrated area to the high concentrated area. So we need energy for this one. The next is endocytosis and exocytosis. Endo means inside and exo means outside. So how the drug is going to move inside and outside? By phagocytosis. Phagocytosis means engulfment of the thing, anything. So for the drugs which are in larger size, which are high molecular weight, there are a lot of drugs which are lipid soluble, but still their molecular weight is so high, so they can't diffuse. So they can move with the help of this process, this mechanism, endocytosis and exocytosis. For example, vitamin B12, its size is larger. So how it will move? It will move from the gut wall toward the blood through the endocytosis process. The membrane is going to move around it and then engulf it inside. In the same way, exocytosis, they have to emit it outside. So the neurotransmitter are the best example, because normally neurotransmitters are going to be saved in the vesicles. So how will they will move? Through the exocytosis. I am going to make a picture. For example, it's a neuron, and here are the vesicles in which neurotransmitters are present. So how they move out? How they move outside? When they reach at the membrane. Membrane move at the side. It will move at the side, and now allow it to move out. These are the four mechanisms. Any confusion? If you have any confusion about the mechanism, you can ask. So these are the four basic mechanisms through which the drug can move: passive transport, active transport, facilitated diffusion, and the last one is endocytosis and exocytosis. After this, there are some factors which can affect absorption process. So how they are going to affect the absorption? We have to study all of them one by one. The first one factor is pH. The second one is blood flow. Third one, surface area. Fourth one, contact time. And the fifth one is expression of p-glycoprotein. We have to study all of them one by one. First one factor is effect of pH on the drug absorption. Remember this thing, the drug can absorb only when it is present in unionized form. When the drug becomes ionized, it becomes hydrophilic. So it can't absorb. Here is the example for the acidic and the basic drug. Normally, our drugs are present mostly in weak acid or weak basic form. So HA is the acidic drug, weak acidic drug. It is present in an unionized form. Unionized form means it is lipophilic. So it can absorb more easily. When we talk about the basic drug BH, it is present in the form of ion. It is an ionic drug. So it is present in the form of hydrophilic. It's a hydrophilic drug. And hydrophilic drug absorption is much difficult. So the next thing we have to study, less pH mean, just wait a minute. Okay, we are talking about the acidic and the basic drug. If the pH is less, it means the drug is acidic. We all know that below 7, if the pH is below 7, then the drug is acidic in nature. And if the pH is more than 7, it means the drug is basic in nature. So when the pH is less, it means the drug is acidic. So its absorption is more from acidic medium. Why its absorption is more from the acidic medium? Because when the acidic drug is going to be dissolved in the acidic medium, it is not going to be ionized. Will remain in unionized form. Low pKa mean drug is more acidic. Low pKa mean drug is more acidic, and its absorption is more from the stomach. And if the pKa value is high, it means the drug is basic, and its absorption is much more in the basic medium. Here you can see ionized drug. It is water soluble and is less absorbed. Unionized drug, it is lipid soluble. It will penetrate in lipid cell wall easily and get more absorbed. So unionized form of the drug is more absorbable.
I
Again,
have a question.
okay, just wait a minute. Okay, we are talking about the factor that is pH. If the drug is acidic, it will reach stomach, become unionized. Unionized, why it become unionized? Because the medium are same and it will absorb more better in the much better way as compared to the from the basic medium from the intestine. In the same way, if the drug is basic, it will reach intestine. In the stomach, it become ionized because the medium is different. In the intestine, it become again unionized and absorb much in the much better way. The next factor is blood flow to the absorption side. We all know if the blood flow is more to the area, the drug will absorb more from that area. When we talk about the intestine has much larger amount of blood vessel as compared to the stomach. So absorption is much more from here. The next one, total surface area available for absorption. We all know again that villi are present in the intestine, which provide the much larger surface area for the absorption of the drug. Small intestine, larger surface area, better absorption, more vascularity, more absorption. First thing, surface area is larger. Second thing, vascularity, blood flow is much more here. So absorption will more occur. The next one, contact time at absorption surface. We all know that if you have more time to connect with anything, you will know the thing much more better, in much better way. So in the same way, if the drug get more time at one place, it will absorb more. If gastric emptying is with high speed, then absorption is low as in case of diarrhea. We all know that in the case of diarrhea, everything will move with too high speed. So the drug will get less time
So,
for the
with,
connection.
I have a question
Yeah.
that we know that in diarrhea gastric motility increased.
Yeah.
So, is it the reason if the gastric motility is high, then absorption is low?
Yes, drug absorption become low. And if the gastric emptying, yeah, gastric empty is slow, then the absorption is much more higher because drug take more time or it has more contact time with the stomach or intestine. And the factor that delay stomach emptying is presence of food. Here are some examples. There are some drugs who are going to increase absorption, sorry, whose absorption is increased in the presence of food. And there are some drugs whose absorption decrease due to the presence of food. For example, chloroquine, carbamazepine. These are some drugs. Food absorption increase in the presence of food. So we can take these drugs with the food. But here are some drugs like ampicillin, aspirin, digoxin, and etc. The absorption of drug decrease in the presence of food. So we should take these drugs before meal. The next is expression of p-glycoprotein. It is the last factor. What is p-glycoprotein? It's a protein, transmembrane transporter protein. It is used for the transportation mechanism as a carrier and it will pump the drug out of the cell. So in the area where the p-glycoprotein are present in large number, in that area drug will remain at less time because p-glycoprotein is going to pump it out, and it is present mostly in kidney, liver, placenta, intestine, brain, capillaries, almost in all parts of the body. And the last thing, it involved in multi-drug resistance. Multi-drug resistance means it, for example, when we talk about the bacteria, sometimes bacteria modify themselves and cause the resistance, produce resistance against a specific antibiotic. And some bacteria are multi-drug resistant because they will pump. In them, p-glycoprotein are high in number, so they are going to pump the drug outside.